Hello everyone, welcome back to my YouTube video channel, the channel for online dental education, pretty much everything related to dentistry. Today I have a special guest, Dr. Richard Downs. He's the Sleep Balance Academy owner, and he will give us some information about sleep dentistry, how this can be applied for dentist as well as chiropractor. I would love to have Dr. Richard Down introduce what exactly his academy and how he can help us. So Dr. Now, please introduce yourself, what type of work you do right now and how you can help the dentist. Thank you.
Thank you, Doctor. Dr. Wayne, I appreciate you getting me online. I've known you for a while. Virtually, we've never met personally with each other yet, but I'm looking forward to doing that sometime.
Absolutely.
Yeah. So Sleep Balance Academy, I actually started a couple of years ago. I started a website called the Dental Chiropractic Collaborative. And my vision was to bring chiropractors into the profession. What I ran into when I was in sleep medicine and in dentistry was that I would send patients to the physician and they wouldn't come back. We'd go there for a sleep study, they wouldn't come back. All of the patients were put on a CPAP, okay, no matter whether they were mild, moderate, or severe. It was a very long time to get them in. It took a long time to get them back, even if I got one back. I decided to work a way to get around the roadblocks or the traditional dentistry model that depended upon sleep physicians and physicians in general. Not that I don't want to work with them, I actually do. I very much encourage that, but I don't want to have a roadblock keeping dentists from doing this. I've got board certified sleep medicine dentists who are calling me and enrolling in Sleep Balance Academy because even though they have tremendous knowledge, they're not profitable in the programs that they're doing. Okay. So then I gradually started a program where I brought dentists and chiropractors together, and I named the program Sleep Balance Academy, and I can show you that site in a little bit. But Sleep Balance Academy has 25 hours of online CE credit approved by PACE and allows people to get a basic training in sleep medicine. I use it for both chiropractors and dentists. And then we try to put them together into coordinated groups in the different parts of the country so that they work together and giving the best care for these patients. And there's a lot of treatments now that we can do that are not just oral appliances. As a matter of fact, oral appliances are one of the later treatments in our program. We almost have it in last place now. That might shock a lot of dentists who are listening to this podcast or this video, because we believe there's lots of treatments out there that can be done that are alternatives to CPAP and oral appliances that are very good. And it's ideal for chiropractors as well.
I'm so excited. I can't wait to hear you more.
Yeah.
Dr. Dow, can you just give a brief information about sleep medicine, sleep dentistry medicine, and how is this like, a lot of dentists don't know much about it. We all just do dentistry in and out, but we don't really look at the people's throat. We don't look at their airway. We don't even know,
That's right. That's very true, Dr. Witt. In 2017, the American Dental Association passed a resolution recommending that dentists screen for airway disorders. Did you know that?
Wow, 17.
Yeah, 2017. So when they did that, it actually becomes a problem for us if we don't do it. You now become legally liable, and it'll turn into a mandate, really, because it's like when the ADA many years ago recommended we do oral cancer screenings. Well, if you don't do that now, you're legally liable and very difficult. Well, obstructive sleep apnea is the largest unrecognized epidemic in America and around the world, according to the CDC. They actually declared it an epidemic. and we're missing a million. There's 70 million people estimated in the US with obstructive sleep apnea. Not only does it cause problems for your teeth because people clench and grind, many of them do with obstructive sleep apnea, but they also have problems with sleep. Children develop abnormal faces. Their jaws get small. Our jaws have been getting smaller in the modern society worse and worse. And we're teaching airway expansion now as one of the first steps that we want to see people do in order to correct this problem, especially in children, but we can do it now in adults. And I'm actually going to Dallas in a couple of weeks. I'm going to be teaching a course down there with the airway group from Portland. And we'll be talking about airway development with Invisalign and mid-sagittal expansion and SARPI and MARPI types of treatments. So there's all kinds of things we can do, as well as tongue treatments with the laser. So we have lots of treatments that we recommend that are making big strides in helping people with obstructive sleep apnea. And by the way, about 98% of sleep disorders are of the obstructive nature. There's 100 different sleep disorders, more than 100 actually, but the vast majority are obstructive and something that dentists can treat and chiropractors can treat. The other ones, of course, we would refer all to the medical profession.
So are you saying that there's a big amount of patients that dentists can do to help the patient and can diagnose and can recognize and the early intervention or even farther into their diagnosis and help them? I did not know much. Yep.
That's right. And Dr. Nguyen, years ago, all we had was polysomnograms. People had to go to a clinic or a hospital to get a sleep study done. But nowadays, that's not true. The devices are getting so small. Like, for instance, this thing. It's called the circle ring. Okay. Now, this circle ring fits on a finger. This is a high sensitivity pulse oximeter. I did an interview of the company owner today on this ring. Now, this is not an Aura ring. This is quite different. This is an FDA cleared device, high sensitivity pulse oximeter. And it actually is approaching now. They're believing they may be able to get it turned into an actual home sleep study. Now imagine a home sleep study on one finger.
That's beautiful.
Maybe one finger and a nasal cannula, possibly. Okay, just imagine. And that can be done by any dentist. Now, when we started out a few years ago, there were 3 states where dentists were not allowed to order a home sleep study. We're talking about ancient history. Well, look at now there's 7. People are trying to restrict dentists even more, but they can't keep up with this. And by the way, the dentist doesn't have to order this. In those states, the patients can order their own. And there's no law preventing a patient from ordering their own sleep study. And I have 2 sites that people can order sleep studies from, not just this one, but other ones that you can do. This one, you can screen patients over and over again. And when you put an appliance in their mouth, you can use this thing for titration. This is the easy way to titrate. Before, you had to titrate with another sleep study, and it was expensive. Now it's virtually it's so inexpensive that we can get great numbers of patients in the door, screened and taken care of. And the unrecognized people walking around with obstructive sleep apnea can now be at least addressed, instead of just letting it go. If you don't want to treat them, fine, send them to somebody who can. It's not like everybody has to treat these patients.
Dr. Dow, you mentioned the 7 states that allow dentists to
don't allow dentists to order a home sleep study. Do not.
What are those states?
I don't have them on top of my head right now, but I think Alabama was one, but that's been that way for a long time. And then there's some others, but they've expanded. It's just people trying to say that you can't do them, and their excuses, they want more quality, higher quality, better patient care. But really, I think it's more ancient history. I think it's centralized care has gotten in a quagmire of care that, sacrificing higher quality care for getting people. I mean, let's take a University of Wisconsin study done about 10 years ago. there was a study done on sleep apnea patients, a group of researchers up there that did the actual studies themselves. They did the study and then they sent the patients back out. And by 10 years later, more than 90% of them had not yet been diagnosed with obstructive sleep apnea by their primary care physician. This is ridiculous. I mean, known patients with sleep apnea, how many people are even being asked about their sleep when they go to their doctor? They're just not being done. And they're not being asked by their dentist either. And we need to change that. You know,
would you have some presentation ready for us today?
I'll show you some of the resources that we have for you, and then you can decide if you want me to talk more about them. I'm going to share my screen if that's okay with you, Dr.
Sure, please. Thank you.
I'm going to show you first the Sleep Balance Academy website. Let's go here. Let's just go to, I'm going to go to the home page. Okay, this is the Sleep Balance Academy website. You can see that, okay? All right. And in here, we have information about what it is for dentists and chiropractors, and some of the things that you'll see in here. For instance, the old model for sleep medicine for dentistry and the new model, which we are adhering to, and kind of gives you the contrast between the two. Okay. You'll wonder how I got into chiropractic. It's a whole new source of patients that dentists have never tapped into, and we cross referral with the chiropractor. Matter of fact, they're doing the diagnosis and doing the sleep studies now. I'm teaching them that sort of thing. And you can become a member, and membership goes back here. And in the membership program, we have modules or curriculums for study here. These are the curriculums. And some of these you can see as a preview, and some of them you cannot until you purchase the one-year membership to belong to Sleep Balance Academy. But like I said, there's more than 35 hours of studies in here on basic sleep medicine and dentistry as well. And there's just some of the faculty. This is Dr. Joseph Selk. He is a double board certified in sleep medicine, and he is our medical consultant and does our diagnosis and prescriptions for the patients that go through the sleep studies. Dentists cannot make the diagnosis, nor can chiropractors. They have to be done by a medical professional like Dr. Selk. Shirley is our myofunctional therapy expert. And then we have other faculty members on this program as well. Okay, so that's where you go. And this is where you go to join Sleep Balance Academy. Okay.
Dr. Dow, let's say if somebody who just graduates from dental school, should they take this course, or they should wait for until they be a little bit more confident with the dentistry overall, or what would you recommend?
I think it's up to their comfort level, Dr. Nguyen. If they want to learn sleep medicine right away or sleep dentistry, I think that would be good. At least enough. They should know at least enough, Dr. Nguyen, to be able to screen their patients. And I'll show you the screening forms in a minute.
Okay, yeah, that's something that will be important. Like symptom screening.
Right. So these are our documents for Sleep Balance Academy. They're available to our members. We have super bills with all the diagnosis codes and everything on them. We have the screening form, which is a simple screening form. And this one can be done by anybody, dentist or chiropractors. It has 3 sections, our regular medical section. And you can see the answers to these questions are weighted with numbers. Like, for instance, if you're overweight, they get a score of 3 here. And so you total up the scores for section 1, 2, and 3. And then anything over the score of 7, we recommend a sleep study for this patient. Okay. All right.
So when you say you recommend a sleep study, what type of sleep study are you talking about?
Okay, let me show you our other website. We have more than one sleep study, and I'll show you that next. Okay. So let's go to onlinehomesleepstudy.com. Now this site was developed mainly, and by the way, a lot of chiropractors are DOT medical examiners now, and truck drivers, ship captains, and airline pilots are mandated to have their sleep evaluated. Okay, otherwise they produce accidents like the Exxon Valdez, and we don't want these disasters happening with anybody, including on our roads. So I started this site for that, but now anybody can use it as far as patients or dentists who want to do a sleep study. Sleep studies are available here, and we'll go to the store and show you some of that. So in the store, you'll see our different sleep studies. Now, this is the one called Aries.
Yes, doc.
Aries.
Yes.
Is that me or is that you?
Yeah, but he didn't
It's
answer.
the background. Sorry about that. You can continue.
Okay, sure. And so that's the Aries sleep study. It's a very comprehensive sleep study that is, we can order that for you. It goes to the patient. It goes, they wear it for 2 days.
But he
It goes
sent it to
back
me.
to Watermark. And then once
He
it
sent me
does,
him the- well, like you said,
it's diagnosed by a physician.
What I understand.
This one is called the Night Owl.
The walk in.
Night Owl is a one finger sleep study. It fits on one finger.
Oh, darling.
And
And then
this
we'll
one's
see
disposable.
If I can get something from Henry Shang that
Mhm.
we're
yes. Yeah, is that my background or your background? Do you know? I'm thinking, okay. Anyway, that Night Owl is one that, like I said, we can do 7 nights of sleep studies on it. Actual FDA cleared sleep studies on this particular device. And that's what the report looks like right here. Okay. When you get your report back, gives you an actual AHI, apnea hypopnea index, and the score. And you can see here the total sleep time, the events per hour at 3% or 4% desaturation. All these things are explained in our course. And then this one here is a newer one. It's called a sleep image ring. This one we can use on children down to age 2. Okay. So this is the only one that we have that we can use on children right now. But it's certainly a lot better than the old strapped up in a hospital type of sleep study that they used to go through. Now, these kind of devices are available and also for purchase through Sleep Balance Academy. On this site here, you can see that we have them listed at retail prices for patients that want to buy them. There's another sleep study that we provide. And so we have different types. Here's some of the, this is Dr. Zelk. He'll do some of the insomnia treatments online by telemedicine. And then here's another treatment that we can do now. This is called an INAP, which is a little tube that fits in the mouth and creates negative suction. This can replace the CPAP for many patients, and it's approved for all severities of sleep study, mild, moderate, and severe. And most people don't know anything about these devices. And they don't know anything about EPAPs either. But imagine this thing. This is perfectly ideal for chiropractors. Okay. This is a tongue myofunctional trainer. It's done with electronic terminals on it with a tensing machine, and it tracks and strengthens your tongue to open up the airway. So there's numbers of treatments in here that we have, even more than this that I'm showing here with Sleep Balance Academy. Okay. Pretty mind bending, isn't it, Dr. Red?
Amazing.
Yeah. So we have those 2 websites, and like I said, I'll show you some of the stuff in our store here. This is the store, and this is where you can get your coaching modules, temporary appliances. These temporary appliances are used to bring the jaw forward. We have EMA devices. Here's the INAP. And there's the different parts of the INAP. This is the internal, this is the oral part of the INAP. Some chiropractic information here. Nasal aids or dilators for your nose, because many people have collapsed nares and nasal valves. Here's our Excite-OSA tongue stimulators that we talked about a moment ago. Here's the Night Owl Sleep Study. There are 2 versions of that. And you can see it fits on 1 finger. Very inexpensive. We can get these to you for $150 a piece. And then our chiropractors, some of them are billing $500-600 for that sleep test, which is still very reasonable compared to the thousands of dollars that they'll spend going to the sleep center. And then down here, Epap Therapy. These are devices that fit in the nose. They have what is called expiratory dilation of the lungs. In other words, when you breathe in through these devices, there's no resistance, but when you breathe out, then there's a small resistance, and that stents open the lungs and the throat just like a CPAP does, but you don't need all the equipment. So there are lots of treatments other than CPAP that we can avail you with, and dentists and chiropractors can use. Okay, and some of the diagnostic services that we provide through Dr. Zelk and other physicians that work with us in all 50 states. This is a positional device that will train you to sleep on your side. Many people sleep better on their side. And here's that screening ring I just told you about a while back. This is the old ring. This is the new ring. This actually has an ECG terminal on it. Okay. How about that?
Amazing. There's so much to learn, and
Yeah.
I noted that there is a huge amount of information on this website. So the way it works is you pretty much the patient had to find the exactly dentist or chiropractor who specialize in these in order for them to walk through and get the right device or get the right treatment.
Yeah.
Otherwise, this website seems to be very comprehensive with everything that people can learn or wanted to be treated for a sleep problem.
Yes, that's exactly right. And we have different coaching packages for people so we can handhold them through the first implementation of this in your practice. Like I had a board certified dental sleep medicine practitioner in Ohio talk to me yesterday, and she was having problems because she was sending patients to the doctors there, the physicians, and they weren't coming back. So here she is, highly trained in sleep medicine. She knows everything that we have, just about everything that you need to know. And she didn't know that how to get around this roadblock. Well, we have solutions for her right away. We know how to do that. We can send that Aries to her patient right here. It'll be sent to the patient, diagnosed, and sent back to her, and she'll get a report and also a prescription for treatment that includes the INAPs and the bongos and the Excite-OSA, all as options for her. So we don't have to be blocked by physicians on this treatment anymore. And of course, I want you to work with the physicians, but I don't want you to be at their mercy either. Okay. Does that make sense?
Mm-hmm. Yes.
Yeah.
Dr. Dow, so how long have these, I mean, how long have you been developing these products, and also how long you've been treating those sleep case?
I've been treating sleep apnea patients for about, I would say 13 to 15 years.
I see.
Yeah. It's been rewarding, and most dentists did, all they learned was oral sleep appliances when they started out. That's all they learned. They don't know anything about alternative types of treatment, or very little about alternative treatments. And they also have no way to get around these roadblocks, but we figured that out with Sleep Balance Academy. Definitely want you to work with your physician, and the more you know and introduce to them what you can do and show them the results, the more they're going to be starting to refer back to you. And I hope that relationship is developed. But like I said, we don't want you roadblock. Fewer specialists in sleep medicine are being graduated now, so the bottleneck is actually getting worse in sleep medicine. It's not getting better. So we need a way around that. screening lots of patients. The difficult ones that are not responding, of course, you can get them back to the physician for CPAPs if you wish to. Many times that's the best treatment. I have a number of patients who are on CPAP that are doing great, and I just say, stay on that. Don't change. Now, we haven't talked at all about airway development here, Locke, but airway
So,
development is big.
please show me some information about that, please.
If you want to get some information on airway development, I would recommend you go to I got a WhatsApp that I didn't have that ready for you. I'm sorry, but the airway group,
No problem.
Portland, is one that I recommend. They teach MSE, they teach Invisalign, they teach how to use the laser. Look, I'll show you my office website for sleep medicine. Oops, we'll go right here. And this is my medical website. Matter of fact, I used to develop these for people and offices. We would build their websites for them. Okay, but now I don't do that anymore. But in here, types of treatment, and I've been adding to this just lately, but I'll show you some of the types of treatment. And one of them is the laser called night lace. And the best person that I've found for treating or teaching that, excuse me, that's not responding here, is Harvey Schiffman from Florida. He uses the Photona for night lace, but we're not only using it now for just the palate and the tongue, but we're actually using it on the opening for the nasal collapse. Okay. Yeah, I'm not show you what. Oh, that kind of gives you that one moved. Let me try this again. Maybe I just didn't know it. Oh, here it is. So here's the EMA appliance. This is the dorsal appliance, the tap. This is one that will actually help open the nasal passages by pushing out on your cheek. And then this is the laser I've been using in my practice, Photona, for shrinking the palate and firming it up and raising it off the back of the mouth. This is the Bongo RX, the INAP, and the Excito SA. You can see that I'm trying to introduce and educate patients through this website. Okay. But airway development, don't have a lot of information on that yet. I do talk about MSE in here, MSE, but I need to get more information in here. Okay. All right.
Dr. Dao, thank you for a lot for the introduction. I'm hoping to get you back another day for different more like specific topic. You have so much to share here, and the dentist or the chiropractor can definitely be beneficial for this presentation. I'd like to. Is there anything else you want to say before we close up the podcast today?
Oh no, I think that's it. Thank you so much for interviewing me. I appreciate it.
So the website would be sleepbalanceacademy.com.
Right up there, yeah, sleepbalanceacademy.com.
And this is for both dentist and chiropractor, correct?
Yes, yes. And then if you need to talk to me, just click down here. I'll chat with you.
Yeah, that's the one I've been talking to.
Thank you very much, sir. You have a wonderful day.
You too. Thank you so much. I appreciate it.
Thank you. All right.
You get stop sharing.
Well, actually, he just need to disconnect it.